Most of you would know me, but I'm Derek Francis, General Manager, Bogan Shire Council. And before asking our Mayor Glenn Neal to open proceedings this morning, I'd like to acknowledge the traditional custodians of the land, the Wongabong people, but also recognise that Bogan Shire covers both Wongabong, Nyampa and Whale-One nations, and I pay respect to elders past and present and emerging leaders with whom we're proud to work for better outcomes for our community. And a welcome to Susie Teagan and Marnie Colony from the National Rural Health Alliance. Glenn?
Good morning, everyone. To begin with, I'd like to welcome our visitors to Bogan Shire. Thank you for being here today for us. Great to have you here. Our council works hard to provide a full range of services for our rural community, which includes the traditional council roads, water and rubbish, but in addition, childcare, a youth centre and the Bogan Shire Medical Centre. All of these together contribute to our vision of comfortable country living, enabling our community to have the same access to services as people in the city. The Bogan Shire Medical Centre is one of the most important facilities in town. Local people now have access to bulk billed healthcare that wasn't available a few years ago. I'd like to thank Susie Teagan and Marnie Connolly from the National Rural Health Alliance for coming all the way to Nyngan today to present their report and for their advocacy for increased financial support for rural and remote multidisciplinary healthcare teams which reflect the local population health need. Thank you, and thank you for being here with us today.
First of all, I'd just like to thank you for welcoming us. The last time I was here, I'd actually studied at University of New England, and then I lived in Dubbo for a year and a half. And I think the last time I was here was probably about 16, 17 years ago. So it has changed a bit, including this building. So I'm delighted to be here, and partly because it's always expected that rural people have to travel to the city to know about or to learn about or to be part of anything that is done at a national or a state level. And I've lived in rural and remote Australia for more than 30 years, and I just could never quite understand when Australians, such a large population of Australians live there, that the only time people are willing to go to those regions is when they're part of some sort of journey or holiday or whatever. But we've been working with the Bogan Shire Council for a little while, and we have worked together to see how we can develop some models that might actually be a solution. But it actually requires a lot more. The work we've undertaken with the Nous group, an independent and well-established consulting group, was meant to provide the data about access to care by rural, remote and regional people. So it's not about the additional funding programs, it's really about when a person goes to a doctor or an allied health professional or nurse or hospital setting or NDIS, does that person receive that care? Rural Australia contributes significantly to the Australian economy. Figures from the Reserve Bank indicate that the predominantly non-urban resource industry, agriculture, fisheries, forestry and tourism contributes 80% of Australia's exports. That's something I would be really proud of if I were to look at rural, remote and regional Australia. These predominantly non-urban industries represent a large proportion of Australia's economic output, and that is about 30% of Australia's gross domestic product. So farmers alone produce about $60 billion worth of goods each year. The agricultural supply chain supports 1.6 million jobs, and more than 90% of Australia's agricultural businesses are wholly Australian owned, the majority are family owned and operated. The overwhelming majority of food sold in Australia, or the food that people eat every day in Australia, so 90% of that food is produced by rural, remote and regional Australia. So it's the vegetables, the meat, the eggs, the lamb, the beef. And as I mentioned before, almost 50% of the income from tourism is also produced by rural, remote and regional Australia. The problem is that the life expectancy of people in those regions varies between geographic areas by 13.9 years for males and 11.3 years for females. The highest level of both males and females is 85 years for males and 88 years for females. In Sydney, for example, the Hawkesbury, Balcombe Hills or Ryde, the lowest level for both males and females in rural and remote places like the Northern Territory is 71.7 years and 77.1 year. So that's a significant difference in the health care access and the life of a person. The total burden of disease in remote and very remote areas experience a 1.4 times the burden of disease of major cities. Inequity remains the static between 2015 to 2018. And why is that? Because rural people have a triple disadvantage. The burden of disease in coronary heart disease, chronic kidney disease, lung cancer, stroke, suicide and self-inflicted injuries, type 2 diabetes, coronary heart disease is often doubled what it is in the city. Suicide and mental health, 2.1% of what it is in the city. Diabetes, twice as prominent. The triple rural disadvantage are the social determinants of health that I've just spoken about, the high cost of access to services, so it costs more to deliver care in rural and remote Australia, but it also costs more to drive from one place to the other. The costs of everything you deliver in rural and remote is higher than in the city. And the poor service availability. So not only is there an inequity in expenditure for rural and remote Australia, there's an inequity because of those triple disadvantages. The initial report, titled Australia's Health System Needs Rebalancing, a report of the shortages of primary care services in rural and remote regions, was published by the Alliance in 2011. It was based on figures of 2006 to 7 data, and it found a discrepancy then of $2.1 billion. And then in 2011, we renewed this report and it was a 2.4 billion underspend. So we now have an underspend of $6.55 billion per annum for rural and remote communities, which means approximately $850 per person. So what did NAS find? When you look at the patient access to healthcare, on average, these people are not able to access doctors, nurses, allied health professionals, physiotherapists, any care that is in primary care. What we did notice, there was an increase in people having to go to hospital, because by the time they have problems that are so big that you can no longer deal with them, they end up going to hospital and they're there for longer periods of time. The biggest deficits in accessing primary health care and MBS expenditure and private hospitals. So they are the three areas where people are not accessing the care that they deserve. And the recommendations from the National Rural Health Alliance are around locally based solutions to care. So you have had the privilege of being in which is part of the Nyngan Shire Council, and they have taken the lead of actually providing some of those services. But in the end, it is you not only paying your taxes, you're not only working in the industries that bring in the money, but also you're raising money for services such as the RFDS. So 50% of the RFDS services come about because of community fundraising. Then in addition to that, you're raising funds for your local hospital, and then you're paying your rates, and Nyngan Council takes that money and supports you through a service. We're looking at equity in funding, and then also a subsidy for those areas that address the triple disadvantage. The government recently released some new Medicare item numbers, bulk billing item numbers. Medicare was never institutionalized to be a total payment for the cost of a service. It's a public health insurance. It's like when you have private health insurance, it gives you a certain amount of money and then the rest is a gap. But what you've actually had over the last few years is governments telling you, and I'm being really brutally honest here, telling you that you should be asking for bulk billing. But it's setting up those people that deliver the mental health services, the GP services, up to fail. Because that Medicare service that you are being reimbursed for actually doesn't cover the costs. And so it needs additional funding, like block funding, for services such as yours, to be able to remain feasible and viable. And it needs to be very much a locally based solution. So it'll be the primary healthcare network, local government, the local hospital, the local doctors and nurses and allied health professionals sitting down and going, this is what the population health needs, because there's plenty of data about what this population needs. These are the services we currently have, and where's the shortfall? You will never receive, even in the city, everything that you want. But there are some basic things that you should all be able to access. And if the market fails, it's economics 101. If the market fails, that is where government needs to step in. And so you have every right to advocate and to say you've had enough and you deserve those services. We've put some recommendations forward to the Minister for Health and also the Rural Health Minister, where we have said that PHNs, local government, the RFDS, workforce agencies, local health services and ACHOs, because the Aboriginal communities are also not getting the services, although their ACHO model is actually working much better than if you just left the market to decide what you require. And by bringing all those stakeholders together, you're actually able to work on a solution locally, but then the government needs to support that model, because city-based models do not work in the country. You don't have the opportunity to refer to a specialist down the street. You don't have the opportunity to pay the same rate. So if you employ a nurse or an allied health professional, with the current system, you are not able to pay the same conditions and the same pay for somebody that works at a regional health service. There needs to be some equity. Why should they get long service leave and holiday leave and additional workforce support in a government funded entity, and they're not willing to support it where the market fails? I'd like to take this opportunity to again congratulate Bogan Shire Council, particularly Derek Francis and Deb Wood, because the community, and the Mayor, because the community is very lucky to have such a proactive council. We have spoken with councils and also services around Australia that are in a very similar situation like you. Sometimes the RFDS picks up the costs. Sometimes, I've got one community where the farmer who has a spouse that works part-time as a GP is supporting the community out of post-tax farm income to pay and subsidise the local community to have a health service. We can't continue like this. That's not your core business. And while it is it is great to expand the core business, it needs to be funded from somewhere. And I recently spoke at the Local Government Association meetings about this. I'd also like to thank the team at Nous who produced this report. They were thorough and committed, and nothing to try to reduce the veracity of this report will work. There'll be plenty of comments about, oh yes, but we're doing all this other stuff. It's not actually translating to patient services. You live in a fabulous part of the world. There are so many positives about living in rural and remote communities, and the Alliance is advocating for you to have access to the healthcare that you deserve. Thank you.
Thank you so much, Susie. There's lots for us to think about and talk about in all of that. Deb Wood, our Director of People and Community Services, is responsible for the operations of the Bogan Shire Medical Centre, and I've asked her to make a few comments about the centre to put what we do in context with what Susie's been talking about, including the need for additional funding. Thank you, Deb.
Thanks, Derek. Good morning, everybody. The Bogan Shire Council has taken on responsibility for establishing, operating and funding the only medical centre in town for the last 6 years. Back in 2015, the retirement of the town's long-standing doctors was set up to leave a gap in our primary health care. As a council, we understood the barriers for a new doctor to establish their own practice, especially in a remote area. As a result, the Bogan Shire Medical Centre was established to avoid a critical lack of locally accessible primary, allied and specialist healthcare services. As it was, even in 2015, it was common for the local community to travel for up to 2 hours to the city of Dubbo to access even further to access healthcare services. Our quality accredited practice has grown over the last 6 years with 2 building extensions to accommodate the range of services, including podiatry, physiotherapy, sonography and pathology, together with doctors and nurses to provide care in a supportive team-based environment. We will soon have additional diabetes support and an Aboriginal health practitioner joining the team to achieve better health outcomes for Aboriginal people within the community. The Bogan Shire Medical Centre is considerably subsidised from other council revenue, with annual expenditure increasingly outweighing income from patient fees. This situation has developed with the increasing costs of providing GP services due to market forces since the practice opened. In the long run, this will start to erode council's accumulated revenue and limit the amount of discretionary spending available to fund its other services. Recent Australian Government announcements regarding Medicare bulk billing increases will assist the practice's financial situation. However, projections indicate that we might expect only around $100,000 in additional Medicare fees. This still leaves an annual financial shortfall in the hundreds of thousands that will negatively impact our community. This is fundamentally inequitable, as local councils servicing urban communities do not have to carry this financial burden. The Bogan Shire Medical Centre offers a wide range of multidisciplinary healthcare services to our remote community that they cannot do without. Our practice doctors have even reported that we have people alive in our community today because of the service provided by the Bogan Shire Medical Centre, a really clear indication of the need. Thank you.
Thank you, Deb. Yes, there's no doubt about the need. So that brings us to the end of our presentation today.